The day that I called, I was like, I need you guys today. Like, not tomorrow, today. I was in that day and started. At that moment, I was having meth withdrawals, and I was mixing heroin and meth. I got into a car accident a while back, and well, a couple years back, like in 2020. And when I got into that car accident, they gave me pain pills. And from those pain pills just led to everything.
I've had so many people come in and say, you know, I had a car accident, I had an ankle break, I broke my arm, you know, and that's when their addiction started. The problem is that you develop tolerance and you need more and more of that medicine to get the same effect. So what ends up happening at some point is prescriber either catches on or there is a discontinuation of that medicine. Well, then you're starting to be in withdrawal.
I just ended up looking all over in different ways to numb the pain.
Withdrawals are so painful. You have flu-like symptoms, diarrhea, nausea, vomiting, headaches, shaking, chills, sweating. Some people report that they feel like their bones are breaking. It's just miserable. So it gets you hooked in that way. What we do is we use the buprenorphine, which is Suboxone, to bridge that to where you don't have those experiences with withdrawal. And it helps get you off of the opioid because it takes away that withdrawal. And then slowly over time, you taper it lower, 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 and then you get somebody off of it.
I don't have the cravings. I don't have any type of like the night sweats, my brain going a million miles an hour, everything. I'm able to think, I'm able to use my mind clearly so that I can be who I am.
Medication is great. It can help decrease that craving. It can turn off that noise. If you don't get the noise shut down, that makes any treatment that you're doing more difficult. I just try to meet the individual needs. Is anger a problem? Is depression a problem? Is anxiety a problem? Is past trauma a problem? Usually the substance use isn't the problem. That's the behavior that creates a lot of problems in their life, but there's usually something underlying that substance use.
Get them scheduled, they come in, we do an intake. During that intake, we will talk about do you have a home? Is it stable? Do you need help with food, transportation? Do you need clothing? Just trying to figure out what needs that we can assist with. It's like a weight lifted off of the patient.
Whenever you've been homeless, whenever you've ate out of garbage cans, whenever you went to the ER just to get pain meds and you'll hurt yourself for a pain medicine, or go just hoping that they'll give you something and go sit outside of the emergency room and sleep and, you know, just beg and plead for your next high. You don't really want to do that anymore.
It's not fast. You know, if it took you 30 years to get here, it's not going to end overnight. Honestly, I feel like it's the bravest thing that somebody can do is to stop and go, I need help with this.
The only thing I really want to do is hang out with my family and my kids, and, you know, I missed a lot of that. You don't have to keep struggling.